Today, I would like to talk about three important words in medicine: stat, ASAP, and today. We will define each of these and talk about why the definitions can be important. But let's start with the definitions. Outside of the medical industry, stat is usually short for statistics, as in the stats show inflation is rising. But in medicine, it has a completely different meaning. Stat means right away, and comes from the Latin statim, meaning instantly. ASAP is short for as soon as possible, and it means just that. The thing needs to be done as quickly as it can be done. Finally, we have today, which is such a common word, we might not think it needs defining. It means this day. In fact, all of these words have pretty clear definitions. When we watch medical shows on TV, the doctor shouts stat, and everyone jumps into action. That may be the case in an emergency room during an emergency. When the doctor asks for medicine stat, one of the nurses should be looking for it and administering that medicine as quickly as possible. The same would seem to go for ASAP. If the doctor wants something done ASAP, I, the nurse, should stop what I'm doing and go do what the doctor wants. That's my job, right? But it is rarely that simple. There are two problems. The first is that many things don't happen instantly, no matter how stat they are. Take laboratory exams. Someone has to draw the blood from the patient. Someone has to take it to the lab. The lab has to do the test and then give the results back to the nurse or doctor. This all takes time. The second problem is that in any hospital at any time, there are hundreds of urgent cases, all at the same time. Nurses know this all too well. The patient in room 10 wants his pain medicine right now. The doctor for room 12 wants something ASAP. But the nurse aide said that the patient in room 11 wasn't breathing right. And until I see what's wrong with them, everything else can wait. In a good facility, everyone trusts each other and trusts in our professionalism. The doctor knows that if a nurse doesn't drop what she is doing to meet the doctor's needs, it's because she's doing something more important. Where this trust is lacking, this can be a huge source of conflict, which is why many institutions have clear definitions for terms like stat, ASAP, and today. In the last hospital where I worked, stat was defined as within 2 hours. That might not seem like much compared to instant, but when you factor in things like ordering tests, obtaining necessary equipment and samples, running tests, etc., it can still be a hard limit for staff to achieve sometimes. ASAP often has a more vague definition, and this can lead to many conflicts. When the doctor orders something ASAP, it is up to the person performing the order to decide how soon it is possible for them to complete the order. A simple and common example is an X-ray order after normal working hours. It's 5 p.m., your patient isn't breathing well, so you order a chest X-ray to rule out pneumonia, ASAP. But there might be only one radiologist in the department for the evening shift, and they have 6 stat X-rays waiting in the ER. So you wait and wait. The same thing might apply to laboratory. The night shift might be understaffed, and they might decide that ASAP means when the day shift arrives in the morning. Today is subject to similar issues. I once worked at a hospital where the lab and X-ray departments were so short-staffed that they regularly did tests ordered today at 11:30 p.m., which is technically today. So be warned. So what can you do about all this? You can learn what the various terms for levels of urgency are used in your facility and what they officially mean. You also need to communicate with other staff. Learn what goes into getting a test done and what other tasks have to be done at the same time and what hurdles they may face. And then write your orders with that in mind. Most of the time, that means using STAT and ASAP a little less often. As a nurse, there is nothing worse than a doctor that overuses words like STAT and forces you to stop whatever important thing you are doing because he or she wants you to do their order first. But not always, especially on the night shift and on the weekend. If you want anything done, you might have to label it STAT. Some facilities simply don't do certain things like x-rays unless they're marked sufficiently urgent on the weekend. Or they might have a small crew, but if they have enough STAT orders, they will call in more staff. So it pays to learn the ins and outs of using these terms in your facility. And finally, we all need to learn to trust our coworkers to be professional. We all know how urgent our cases are, and we will act accordingly. If it doesn't always look like that, it's often because we have other duties that are equally important. I hope you enjoyed this little medical story and explanation, and if you wish to see and hear more, give me a like and subscribe, and I will see you next time.